a we thing.
It's a we thing.
Welcome to our second episode of our podcast. My name is Anna Huff Davis.
And my name is Naomi Cottoms.
And we're coming today to talk about how we as community health workers operate and give you a little bit of history of where we came from and the work that we have been engaged in.
We're excited to have you listening to our information today, our thoughts and ideas, and certainly hope that something will be shared that will be beneficial to you.
I want to share just a little bit of my background as to how I got involved in on this journey of community health workers and how I initially operated and didn't know or was not familiar with that term, community health worker. Some years ago, when I had the opportunity to serve as the leader of a nonprofit here in the Delta, I was working with multi-county efforts trying to bring together healthcare and health-related entities across the multi-county region of the Delta, and found that there were a lot of activities underway, but people really needed some resources. And the resources that we received at that time were through the federal government, the Health Resources Services Administration, out of Health and Human Services. And these funds were awarded whereby we could provide what we called mini grants to networks, small networks that had been created to work on health and health-related issues. Now, a lot of these counties hadn't worked together before, so it was a really interesting time in the Delta and across the state. But we were able to pull together multi-county networks and provide them with financial as well as technical resources and human resources. And some of that human capital came in the form of individuals who were providing direct services. And so I'm going to leave it there and continue this story after Ms. Cotton shares a little bit of the work that she was formerly engaged in and is still engaged in that connected to the work that we were doing at that time.
So we were a recipient of some of the funding that Ms. Davis was sharing in community and became a part of one of the networks that she was working with. So Tri-County Rural Health Network was trying to figure out what our role was going to be in community. We were just starting up. We were trying to figure out what the community needs were, how we could be most beneficial in whatever we did. And so Ms. Davis provided us with the dollars needed so that we could do asset mapping, looking at the various resources that are available. She enabled us to be able to engage the community in a way that helped us to understand, after finding out what was available, why people did not access the resources that were currently here. And so it was an exciting time. It was a wonderful time. We learned a lot about our community. We learned that even though if we knew about resources, we didn't access them because we were fearful about accessing them. We didn't. Sometimes we just didn't know. And then sometimes our priorities were different because we were an impoverished community. And so because of her work with that organization and her ability to assist other organizations to do outreach in the community, we were able to actually start our program.
I am so excited. It just gives me so much joy when Ms. Cottom shares that story. And in addition to Tri-County Rural Health Network engaging in the work that they were engaged in, we were able to also assist some other networks that are still in existence. And so we're just excited that we were a part of laying some of that groundwork. And through these efforts, we found that individuals who were providing the direct services and serving as the connectors throughout the communities, they needed some support along the way, not support in the sense of financial, but financial was a part of that. But they also need a way to connect with each other. They needed a way to share their stories. They needed a way to increase the knowledge and the understanding about what they were doing, because they were what we call natural helpers, but they also needed some guidance in regards to how you do certain things and some of the rules and some of the regulations that they would need to adhere to when they were connecting with people. And so along those lines, we decided that, well, I don't want to say we because I was not a part of that first gathering, But there was a group who decided that we needed to formalize some of this work, and they began some talks around actually forming an organization. And so that's somewhat how the beginning talks around an organization that would support and provide professional advancement and opportunities for those folks who were engaged in direct service. That's how those conversations began.
So, Ms. Davis connected us with the University of Arkansas Medical Sciences Center, College of Public Health, off of community-based public health, Dr. Kate Stewart, who actually introduced our organization, Tri-County Rural Health Network, to Mr. Carl Rush, who was and continues to be the guru around community health workers. And so, when learning of Mr. Rush and being able to spend some time with him, he shared information about what other community members were doing, how they were providing services. And when I say other community members, I mean communities outside the state of Arkansas, communities in other states. So he shared information that we were able to learn from, gain from, and actually adapt to the state of Arkansas, particularly the Delta region. And so we learned a lot. We created our own program. We started referring to ourselves as community health workers. After we started the work, we began networking with some people in other areas and started attending conferences and learned that people had what was called professional associations. And we were excited and came back and utilized our engagement processes in convening community health workers, as Ms. Davis mentioned. And so we started having conversations about our needs as community health workers in the state of Arkansas. We started having conversations about what we'd like to do about that. And so we, after several meetings, we realized that there were some skills that we needed that were not at the table. And so we began to partner and collaborate with other people. A primary partner was the Arkansas Department of Health. And so we met some wonderful ladies who worked with us for a couple of years. And in doing that, our association was born, the Arkansas Community Health Workers Association. ARCHWA, as we all know, is the Arkansas Community Health Worker Association. And we are so proud to be members of the association. We are very much a part of the community, especially the community health worker community. And our mission is one that we value very dearly and we hold dear to us. We are here to support Arkansas community health workers in promoting improvements in health and healthcare. Our vision is to someday see community health workers that they will be seen as a vital profession. ARCHWA will be recognized as a leader for improving the public health, well-being, and quality of life for all Arkansans. And we have several values that we also hold dear: compassion, trust, professionalism, accountability, integrity, and equity. So we're not just talking about an organization that was created with no forethought. We're talking about an organization, a nonprofit membership organization. We were actually founded in 2015, and we are here to support community health workers, not only in our part of the state, but across the entire state of Arkansas. And we want to definitely link up with others across other states. And so I would like for Naomi to share with you her affiliation with, there is a national association. So Naomi, share with us the mission of the National Association. Yeah, we're really excited that not only does the state of Arkansas have a professional association for community health workers, but there is an association that's nationwide, serves all community health workers throughout the United States, and it's known as the National Association of Community Health Workers, or NACHW. And its mission is to unify the voices of community health workers and strengthen the profession's capacity to promote healthy communities. So we're really excited. Our executive director is Denise Smith from Connecticut. And the organization has been around for about 3 years now, and it is moving forward, helping community health workers to develop into a unifying profession that is amazing. It's exciting.
and she's being very modest this morning. Naomi is one of the board members of the National Association. We are so proud of her. And she's also the founding board member of the Arkansas Association. So I, in my efforts, have been trying to follow her lead and be as supportive. And I'm always learning. Every day I learn something new. So I am so pleased that she is still around to share with me her experiences, and also to share with me some things that I may not know that she has learned from the National Association and her experiences in this field of community engagement. So we're just excited about ARCHWA and NACHWA, and both of those organizations. ARCHWA is a member of NACHWA. And so they're both membership-based organizations, and we would definitely encourage you to become a member of ARCHWA and then become a member of NACHWA. The membership for ARCHWA is $25 a year.
And for NACHW, it's $20 a year.
And that's a nominal fee to pay to be a part of both associations that are very much beneficial to the work of community health workers and provide you with that networking and that exposure and also training opportunities. We don't want to leave that out, because as community health workers, we know that there's always some new advances that are coming our way, and we want to be abreast of those advances. And also we want to make sure that we know what's happening in the CHW world.
And so, going back a little bit, looking at our history, not just the work that Anna and Naomi have done, but just talking about community health workers in general, Ms. Davis mentioned how we are natural helpers. We're people who just want to make a difference, who we do it even when we're not thinking about it. We do it because it's our neighbor, it's our cousin, it's our parents, it's our aunts and uncles, it's our friends, it's whoever we know and we want to share. Sometimes people think of us as nosy neighbors because we're the person in the neighborhood who tries to know about everything that's going on, and then we want to share it. We're just not being nosy because we want to know, but we actually want to make sure that everybody knows what's going on, that there is benefit for everybody in the community, especially when it's an opportunity. And so we just naturally do what we do. There's an argument around whether leaders are born or leaders are trained or developed. And so for community health workers, some of our natural attributes enable us and help us to successfully carry out the work. That's not to say that people cannot be developed, that people cannot learn, but that's to say that the majority of us just automatically bring some of the attributes or characteristics of a community health worker to the table via our lived experiences, via what life has helped us to develop as human beings. And so we often refer to ourselves as lay citizens. And it's important for you to know that this work started centuries ago. It did not just begin. Our research can take you all the way back to the 17th century when they had Russian filchers helping the military, and then back in China when they had barefoot doctors. And in the U.S., it became really popular in the late 60s and 70s when Latin Americans began to organize and had what was called promotores, and they still have promotores today. We come under many titles, many titles. And for here in Arkansas, Tri-County Rural Health Network established Community Connectors in 2003. And then the Affordable Care Act really put us on the map. And so we've been going and serving people since then. Moving. Ms. Davis, why don't you tell us about what a community health worker is?
Community health workers, as Ms. Cottoms just said, are lay citizens who serve throughout the community. And one thing that I didn't mention that I really want to share is the fact that before we were called community health workers, there were groups of individuals who were performing this work, and even being paid through the federal government on some level. And those individuals weren't organized in the manner that we felt was very supportive or I don't want to say wasn't supportive, but wasn't meeting in a way that was conducive to the movement of community health workers at the time. So we really wanted to bolster that opportunity, and therefore we dispersed, or I like to use the word deployed, what's now called community health workers across the region. And so we started some of the prescription assistance programs utilizing community health workers. And I'm going to get back to what community health workers are in a minute, but I just want to share this with you that community health workers were engaged in medicine assistance. They were engaged in operating food pantries. They were engaged in a lot of the work that we now see that's an organized effort around community health workers. And we want to definitely acknowledge the work that was, as Ms. Cottoms was saying before, that was laid out by community health workers and through the work that they were engaged in. There is a definition that we use for community health workers, and I want to share that with you. The Department of Labor has also recognized community health workers, and we're so excited about that because we know that once there's some recognition, there may be some avenues for resources to be generated toward and for community health workers. So what is a community health worker? They are public health workers in a sense. They connect communities with their healthcare system and state health departments. They are what we call frontline workers. Remember during the pandemic when you heard all this commotion about frontline workers? Community health workers are just as much a part of that landscape as those persons that we saw in the clinical or the healthcare setting. They are from the community. They share some of the same characteristics as the folks that they work with in the community. And they normally know the heartbeat of the community. And so it's very important that we recognize that community health workers aren't people who come in from the inside, but they're from within the community. And they really do maneuver throughout the community. They know where the resources are. They know how to make the connections. They have established trust in the community. And therefore, they are persons that people would share information with that they probably wouldn't share with anyone else. So I hope you get some sense of what a community health worker is and what it means to be a part of the community and to be able to share that relationship with folks in your community whereby they feel a trust there with you, whereby they can share information and come to you with the needs and whatever they may be faced with as a challenge or a barrier.
And so, again, we thank you for listening to our podcast, and we want to invite you to our next one because we're going to have two wonderful ladies who are community health workers here in the state of Arkansas who will be sharing a day in the life. It's a wee thing.
It's a wee thing.